Aloha! So I'd like to welcome you here. I'm Dr. Taketa-Wong. I'm a naturopathic physician and acupuncturist. And today's event, we're going to be taking a tour of a therapy center for children with special needs. And so I'd like to just start off with just a little bit of introduction about myself. For those of you who aren't familiar with me, I'm a naturopathic physician and acupuncturist, as I mentioned. And naturopathic physicians, we're trained as primary care physicians. We can order labs and do school physicals and all the typical things that a regular doctor can do, but we have a lot of training in diet and nutrition, in herbal medicine, and other types of natural therapies. And so that's a big mainstay of the therapies that I do, is that I do specialized medical testing to be able to treat medical conditions that many of our children with special needs have. And then I also want to talk about today a lot of the therapies that can be very helpful for many other children with special needs, and namely, so OT, occupational therapy, physical therapy, speech therapy, music therapy. So I'd like to introduce you here to Grace Dixon Mouser, who's an occupational therapist here at Sprouts Therapy.
Aloha friends, welcome. We'd love to give you a tour of our facility. We offer occupational therapy, speech therapy, physical therapy, music therapy, and feeding therapy for our families. We're also lucky enough to partner with physicians in our community, and we welcome everyone here for parent education and just use us as a resource. Love to show you our facility now. We have tall monkey bars, which are great. Using playground equipment is important for children because we want to teach them functional play skills. The job of your child is to play, to go to school, to learn and grow. And so it's important to have access to traditional pieces of equipment like monkey bars and rock wall, as well as having suspended equipment. Suspended equipment is critical for our kids who crave movement and who need movement to organize their body. It's also a great way to build strength. On the ball swing, we might have a child sitting with their legs in front and holding onto the ropes. We might have them straddling to work on different types of balance in different body positions. We might have them work on pumping the swing themselves. It's a soft surface, so they have to use more core stability to pump versus being on a bolster swing or a swing with a stronger flat platform. We also incorporate tons of balance activities. This is a low balance beam, and what we do is we have children crawl through the balance beam on their belly, slowly picking up the rings using two hands working together as they move through the forward space, like a snake on their belly. This is great for teaching children about how to move through space, depth perception, and using their eyes and hands working together, and it's a ton of fun. This is our airlock. Again, a more non-traditional piece of equipment, but what I love about this is the bouncing reverberation, allowing kids to jump, to practice different types of jumping. We can also suspend this so that it becomes a raised bridge on pieces of equipment. And now we're working on children who might have fear of heights. Again, we're working on balance and using our body in a coordinated manner to get across, whether it's slithering like a snake, crawling like a bear, or crawling on all fours like a puppy. It's a ton of fun, and the kids love using this piece of equipment, whether it's up high, down low, or just to jump on.
And I just want to ask you really quickly, so I know that you talk about the coordination and the balance and all of those, the fine motor skills. How does that incorporate into their language and their behaviors? Because I've definitely seen occupational therapy help with that. And that's, parents of children with special needs may think about balance or coordination, but then I find that most of the concerns are with speech and language and behaviors, and I've definitely seen occupational therapy help with that.
Thank you. That's a great question.
Talk a little bit about the translation between those things.
At Sprouts, we love to offer co-treatment opportunities where the occupational or the physical therapist can be working on these gross motor skills or fine motor skills, handwriting development, while we have the speech therapist there to facilitate the language, whether that's asking for materials during an arts and craft, whether that's labeling the Barbies and describing the clothing and learning about adjectives and prepositions. My Barbie is under the bed. Your Barbie is on top of the box. When children practice skills within play, it doesn't feel like work to them. It becomes a natural environment where they're engaging with people that they have rapport with and feel comfortable, and the language spontaneously happens. We guide it with opportunities for success, providing models when necessary, and also enrichment with visual pictures. Some children have more difficulty processing auditory information, and it's very important that we take breaks, repeat directions, try it in a different way, or provide pictures as well so that they have a different context to match the auditory information with the visual.
Yeah, and I've definitely seen that children with special needs, many of them really need that kinesthetic type of learning and input, and many of them are kinesthetic learners.
I would say the majority of our kids on
right.
the spectrum are kinesthetic learners.
Right.
And one of the handwriting programs that we have is called Handwriting Without Tears. We roll the letters out of Play-Doh. We build them with wooden blocks. We trace them on a chalkboard using wet sponges and dry sponges in different colors. And we make it a dynamic, sensory-rich, engaging task before they ever put pencil to paper. You want to make sure that they understand the stroke sequence. Do they have understanding of top versus bottom? Did they get that preposition work already? There are so many foundational skills to getting up to that, and our hands-on learners have to be shown in multiple ways with multiple media and given different types of prompts so we can identify the best way to teach them the information.
Yeah, and I know that you guys also work with children with ADHD as well.
Yes, we do.
And I will say that many of the children with ADHD that I've seen, many of them, I think they're kinesthetic learners.
Yes.
And that the traditional school environment, which is highly auditory and highly visual, doesn't tend to work for them as well.
No.
Yeah.
And what we find is that for some of our children who are still in a traditional school environment but are struggling with it, there are two different specialty programs we offer here at Sprouts. One of them is a listening therapy called Interactive Listening Systems, and we can do a series of slow build-up using a multitude of different programs, or we can do a more intensive professional program and jumpstart that experience depending on the child's needs and their sensitivity to sound. We also offer a program called Interactive Metronome. Interactive Metronome is a fantastic program because it has multiple research studies specifically on addressing ADHD. And what you do is you complete a series of structured activities to a stimulus, and we measure the response time. It's a standardized program. There are standardized tests built into it, but again, as everything at Sprouts, it's play-based. It's fun. It's about playing games with the child and making it meaningful to them while working on executive functioning, high-level problem solving, multi-step sequencing, as well as filtering out distracting information. Children who complete the Interactive Metronome program with a diagnosis of ADHD, anecdotally in my history, have had fantastic outcomes. Some of my students are slower to pick up the program and they may take 2 or 3 rotations. Other children complete the program in 1 rotation. But it's amazing the way it helps them to make new neural pathways in their brain and to expand the capacity of their executive functioning. I've had fantastic results with everyone as young as 3 all the way up to in their 80s.
Yeah, that's pretty incredible. So, yeah, do you want to give us a tour of
Yes,
some
please.
other equipments here?
We have a ton of balls, bowling pins, and scooter boards. These are so important. Every child needs to work on dribbling, bouncing, throwing and catching. Children on the autism spectrum struggle with ball skills because they struggle with visual attention to task. They struggle with making eye contact with their peer partner in order to be able to complete ball skills like throwing and kicking and catching. Working slowly, starting first at rolling and then building up momentum to bigger movements, starting with a large ball, which is easier to track, and then moving to a smaller ball as your child progresses and becomes more accurate. It's important, again, that everything feels like play. Sometimes kids don't want to be a boy or a girl while they're playing. Sometimes they want to be a kitty. Sometimes they want to be an astronaut, which is why we also have an entire closet of dress-up clothes so that we can work on imagination, creative play, play schemes, body scheme, and it's a great way to work on dressing, buttons, tying shoes, all those tricky things that kids still have to learn, but especially in Hawaii, it's hard to give them enough exposure and practice to do buttons and jackets and snaps and shoes when we don't need them very often. But when we go home to visit our family in the mainland, gotta break out that jacket, so it's still good to know they can do it.
Yeah, yep. Okay.
We also have our scooter board. This is a great dynamic activity where children work in different body positions on the scooter board, working on building up speed from slow to fast. And this is a great way to work on our visual attention. So as the child's going down, we want to make sure that their eyes are on the target at the other end, usually a volunteer or another peer that they're playing a game with. This is a great way to make sure that we're developing the ocular muscles, that they're doing good visual tracking, and that they'll be ready for copying from the board in school.
Yeah. Nice. And it's nice that I think that it's play-based, because I think that makes it just so much more engaging and fun. And
absolutely. Who doesn't want to come to a big, bright, beautiful gym and come play?
Yeah.
And that's what we're here at Sprouts to do. We learn through play. Our children learn through play. So why not meet them at their level, meet them where they are, and bring the learning to them? And that's what we try to do here.
Yeah.
I would say the number one most loved piece of equipment at Sprouts is our zip line. So, kids get to ride our zip line from all the way over here at the top of our mountain. And then they get to crash all the way down into our ball pit. Kersplat.
Yeah.
This is a great way to build up bravery for our kids who may have a little bit of trouble being up a little higher. We work on building up kids' tolerance if it's too big of a distance for them at first. So we might set up platforms and only do it from the halfway point until they feel confident and comfortable. We can also build entire obstacle courses that incorporate the zip line so that kids have their most motivating piece of equipment to help them work through challenging things that may be less preferred.
Yeah. And I know that particularly, I'm sure that works on core strength.
Oh,
too. Yeah.
Goodness. Yes, it does. And hand strength, because they have to hold on to those ropes pretty strong.
Right. And I know that low muscle tone is a really common thing that we see with a lot of the children.
Which is why we like to incorporate things like animal walks. Again, play-based exercises. Your 5-year-old doesn't want to do planks with you. They don't want to do sit-ups with you. But they might be willing to play crab soccer. They might be willing to get down on the floor and pretend that they're a kitty while they're walking over different obstacles. You can even make a giant floor filled with all your couch cushions and have them work on crawling over that. And that is still going to challenge their system and be play-based and fun.
Yeah. And then I think we could just go ahead.
Perfect.
And so we're going to just walk over to another room. So while we're doing that, I'll just talk a little bit about some of the experience that I've seen in terms of working with children with low muscle tone, because actually many of the children with special needs, especially autism, but also in Down syndrome, cerebral palsy, there's a medical condition called mitochondrial dysfunction, where that can be one contributing cause to the low muscle tone. And so that's one of the things that I like to address in terms of medically, because there are specific nutrients like carnitine and ribose and CoQ10 and other types of nutrients that act like the food for the mitochondria. So the mitochondria are like batteries that power all the cells in our body. And so I find that when children who have low muscle tone and they have a mitochondrial issue, that when I give nutrients that help to support the mitochondria, that are like food for the mitochondria, then their muscle tone can improve, and then other therapies like occupational therapies at Sprouts can then become more effective and more helpful.
Absolutely.
So I think that's just one example of how the medical treatments can integrate really well with all the therapies that you guys do.
Absolutely.
To be able to help and just help the child overall, because it really does. I think we both know it really takes a village to help our children.
It absolutely takes a village. Nobody has one answer, and the more we can collaborate and support, then we fill in all the pukas, and that's what's important.
Yeah. And we have a pretty neat diagram over here, so if you could kind of talk about some of this, I think that would be helpful.
Great. One of the programs that we work on here at Sprouts is children who have ASD oftentimes have difficulty with emotional regulation, and it's part of their sensory processing disorder. And children don't have to be on the spectrum in order to have difficulty with emotional regulation. One of the programs that we use to teach understanding, both of your own emotions, developing understanding of your body, and how your emotions impact other people. The program is called Zones of Regulation, and one of our staff members created this beautiful visual to help our children who are more kinesthetic learners, who are more visual learners, to understand these concepts, and for it to not just be verbal information that they are receiving, but a way to dynamically interact with it. For HIPAA reasons, I do not have pictures of the children, but what we encourage is for parents to bring in pictures of the child in all of the different zones, so that the child is not just comparing with pictographs, but is actually comparing their own face, their own emotions to moments in their time in history, to better understand how these concepts relate not as arbitrary, abstract concepts, but something that's true and real and resonates in their own body. It's very different to see a picture of someone confused. It is very different to see a picture of yourself feeling confused. It is much easier to identify, especially for children who have delays in visual tracking and visual scanning. Looking at different parts of the face is very challenging in understanding eyebrow elevation versus eyebrow furrowing and what the difference means. And that's those small details of visual attention that we work on with these students. The blue zone means you have low energy. So these are going to be things like the child is feeling sick or bored, shy, hurt. So these are low energy feelings. The yellow zone are going to be your high energy feelings. So these are going to be overwhelmed, upset, jealous, grouchy, confused, anxious. So these are going to be higher energy. Then
let me just turn the camera around because I think it's backwards. So
okay.
And yeah, there we go. So that way people can see.
Great.
And the words aren't backwards. Okay.
So then we have the red zone, and these are going to be elevated from the yellow. So instead of someone feeling grouchy, they're going to be feeling mean. So when children have to understand there's a continuum of emotions, and that emotions can escalate and de-escalate. When they're feeling something, they don't recognize that they are in control to change their emotional state. We have to help guide them that the emotions are a continuum. We also talk about when your behaviors are unexpected, how does that make someone else feel? We're talking about empathy now. We're trying to help these children understand that their behavior makes their parents or their teachers or their friends feel a certain way because they don't have that skill yet. They don't have that theory of mind and that self-understanding. So we want to work. And for our older children, sometimes the low muscle tone means that they have facial weakness and they have difficulty making the facial expression that they are feeling. And we actually use the mirror to do facial exercises and help them practice elevating their eyebrows, puckering their lips, furrowing their brow, and understanding what those emotions look like, what it feels like in their face for that kinesthetic learning, as well as being able to recognize it in others. And to me, one of the most meaningful things was having done this program with a 15-year-old who then went to school and said, I think somebody was interested in me. I think a girl was paying attention to me, because he finally slowed down enough to look at her face and to look for the things that we talked about. And he also found a better opportunity that he shared with me to talk to a friend and to show empathy to that friend, because he understood finally for the first time in his life that his friend was hurt and upset. And he recognized his eyebrows were furrowed and his mouth was tight. And he could, 1, recognize the pattern, 2, identify what it meant, and 3, replicate it himself so that he could show empathy to his friend. It was a hugely successful moment and something that I'm incredibly proud of to have been part of.
Yeah, so that's really nice. I mean, it's really nice to hear those stories.
Yes,
you know?
it's nice to see when it comes together and that he could spontaneously come back to me and say, hey, that was actually helpful.
Right, yeah.
I got to talk to a girl and I made my friend feel better, and he was having normal, typical social engagement at school with his peers, and nobody had to know that for the first time he got it right because we did these exercises.
Right, yeah.
Ideally, where we want everyone to live is our green zone. Our green zone is our ready to learn state. So this is a state of active learning. This is where children are engaged, they are listening, they feel appreciated, they feel calm. A lot of our children struggle with anxiety when they have sensory processing issues. There's a lot of fear and anxiety that happens because they live in a fight or flight state. They're constantly feeling endangered by their environment, by things that are non-threatening, like a blender or toilet flushing. But those things startle our children, and so they can't live in this ready-to-learn state. They jump to yellow. They become anxious and worried. They become nervous. They feel uncomfortable. Or they let themselves just drop down into blue, and they completely disengage. Other children, when they can't complete the task, they shift immediately down into terrified, angry, and aggressive. Our children are not misbehaving on purpose. They're experiencing emotions, they're learning how to control them, and they're learning what it feels like in their body. The first time you were nervous, you may have had a stomach ache. And if you are a child that doesn't recognize that you're feeling nervous, you just think you're sick. And now that child feels more confused because they don't understand what's happening in their body. These natural signs that let most typical adults know, oh, I should take a break. I should just do a couple deep breaths and then I'll go into my meeting and I'll feel fine. But our child going into the test doesn't have that skill. We have to teach them that. And that's where we need to be patient and help them understand their feelings so that they know that their feelings are not a bad thing and that it is okay to be in all four zones. We all do it, and we can't be mad at our kids for having a red zone day. We just have to share our calm to help them get back to green.
Yeah. Mm-hmm. And I think another thing that I've seen in terms of just when you were talking about things, because the reason that I got actually into all of this is because my younger brother has autism.
Wow.
And so, yeah, so that was really why I got into all of this, because I was constantly looking for things to be able to help him. And yeah, many of the children with autism struggle with the social interaction because they don't understand, like you said, the facial expressions or those nonverbal cues that come really naturally to most of us or to most children. It's baffling to them, and they have a really hard time understanding that. So when you were saying that, one thing that I thought of from the medical perspective is that their research studies find that an oxytocin deficiency, so oxytocin is a hormone that helps our bodies to be able to feel social and emotional connection with others, to feel empathy, to be able to understand some of those facial expressions. So if there's an oxytocin deficiency, many of the children with autism don't have enough of it.
Exactly.
And so it can be given, and that can help their brains with starting to understand some of the facial expressions. But I still tell the families, your child has had so many years of delay, that now they have to kind of catch up to their peers. So I tell them, well, the oxytocin can be helpful in helping their brains to start to understand some of the facial expressions and to feel more desire and empathy with others. But I said someone still needs to work with them in terms of teaching them, this facial expression is this, or like you said, many of them don't even know how to make that that facial expression themselves, and so they're making a facial expression that other people are misinterpreting, and it's not accurately reflecting what they're actually feeling.
And that's why the mirror is such a simple but useful tool, because if they don't feel what their face is doing, they have no idea they're giving the wrong clue.
Right.
And so that's why we do them side by side, and we both look silly together.
Yeah.
And again, makes it more play-based and fun that we're doing these different exercises.
Yeah. And could you talk a little bit about, I know you shared that example, that story about that one boy that you're working with. Could you share another story of, of a child that you've worked with where, you really saw what a difference the therapy could make for them?
I have a child that I work with, and very medically complex, that we actually work with together. And he first came to us, was unable to really engage, no play skills, no real functional communication, medically complex, but at the same time when he interacted with people he felt comfortable with, there just always seemed to be this spark underneath, and I just wanted to see the spark with me. And so we started in a very small room where using more of a floor time based approach, which is more play based, and where the goal is I'm the most interesting toy in the room, and I want him to play with me and not with something else. And so finding those circles of communication that we could open and close together, and getting him to want to be in my space and to want to spend time with me, and to trust that if I ask him to climb a ladder, which he was unable to do, or to climb stairs, which he was unable to do at 9, that I would keep him safe. And so we slowly built our rapport and built up to it, and he is now able to walk up a narrow staircase with close bilateral handrails, and he can walk up 4 steps, turn his body around, and walk down them safely without an adult holding on to him, repositioning his hand or his foot every single time, and is actually beginning to engage in downward gaze to see that the floor is clear. And 6 months ago, when he attempted that, he would go into an STNR, which is a non-integrated primitive reflex, meaning that we're seeing behaviors that are more symptomatic of a young, under a 1-year-old child, and he was 9. So we've been able to work on extinguishing that inappropriate behavior and replace it with the ability to navigate stairs, which are in his home and was a very important safety concern for the family, as well as just seeing him be independent and proud of himself at the top when he turns around, and just the joy that it gives me is unparalleled.
Yeah.
Truly.
That's great.
Yeah.
That's great. I want to talk a little bit about your guys' feeding therapy program.
Absolutely.
And,
would you like to see our feeding room?
yeah, sure.
Great.
Let's go over there. While we're walking over there, I'll talk a little bit about a case of a mutual patient that we have where they're working on feeding therapy with you guys. And then I was also working with that child because he had pretty severe esophagitis, which is an inflammation of the esophagus. So it was physically difficult for him to be able to swallow food because his throat, his esophagus was so inflamed that it was really difficult for him to swallow. And so so with that child, then we worked in terms of doing a number of testing and figuring out what foods were issues for him, and then avoiding those foods were really helpful. And then also there's a number of natural remedies that can be helpful in terms of healing the esophagus. So there's certain amino acids that help to heal that. And so we did a number of those therapies, but he also had a lot of sensory issues that made it very difficult for him to be able, so he, on top of he was really underweight because he had this inflammation in his throat, so it was difficult for him to swallow, but he was also an extremely picky eater. One, because he had a lot of food reactions, but I think also there were a lot of sensory issues. So most people may not be familiar with what a sensory issue is. So could you speak to that a little bit? Like, what is a sensory issue and how the feeding therapy program that you have helps to address that?
Absolutely.
Yeah.
So when we're looking at sensory processing, there are 3 main ways that it will present itself. Either the child has difficulty with modulation, meaning they are over-responsive or under-responsive to a stimuli, typically. Then you have our sensory-based movement disorders. So they either have postural disorder, which means low muscle tone, weakness, poor trunk stability, which is also going to be impacting peristalsis during feeding, making sure that you have enough motility as well as enough muscle strength for the child to hold themselves up during a meal, which is actually incredibly challenging. And most people underestimate how much strength you need to actually be able to feed yourself. And then the third type of sensory processing is going to be discrimination. So meaning the child has difficulty understanding, do I like this? Do I not like this? Is it too much? Is it not enough? So they're having difficulty discriminating between the different types. When we're working in feeding therapy, most of our children are usually presenting with one or multiple forms of all 3. We recommend what's called a trip trap chair or a kikaroo. So we use these with our families to provide postural support. We can add bolsters in. It has a curved back. It has a foot platform and an adjustable seat platform. If you look over here, for children who are more involved,
I can bring it. Yeah. Okay.
so for children who are more involved, this is called a tomato chair, and it's going to provide lateral support on the sides. It's going to provide head support. This would be more for a child with cerebral palsy or extremely low muscle tone or an orthopedic issue that is unable to sit in one of our Trip Trap chairs or kikaroos. So we do have a multitude of positioning tools to look at addressing the postural support or the dyspraxia issues. So then for pattern 1, you're going to be looking at, is your child over responsive? Do they just have to look at a food to be so overwhelmed that they can't handle it? I had a child, 8 years old, came downstairs. There was a flyer for a pizza company that had come to the house, and it was mixed in with the mail, and it was on top. Came downstairs into the kitchen, saw the flyer for the pizza company that is non-preferred, and immediately threw up. There was no food present. There was no smell of food present, but was so visually overwhelmed that the sight of a picture of non-preferred food triggered a gag and vomiting response. So this would be a very strong example of high over-responsivity to visual stimuli. For another child, it might be the tactile or the feel of the food. If they have tactile aversion, they might not want to touch food. They might only eat with utensils. They might only drink from a cup with a lid. They don't want anything to touch them. They can't be dirty. If their shirt is wet or has food on it, they become overly distressed. If there's any food on their face or texture on their hands, they can become overly distressed. This would be over-responsive to tactile. So this child can't tolerate the feeling of the food or the liquid on their hands or their body. So under-responsive is when we have children who don't realize there's food still in their mouth. So a child that's over-responsive oftentimes becomes a stuffer. So they're under-responsive. They don't feel that the food is in their mouth, that interoception body awareness. So they fill their mouth until their cheeks stretch, because it's not until the cheeks stretch that they finally get that feedback of, oh, there's food in our mouth. So that child is a very severe safety risk because they're a choking hazard, because they can't tell when their mouth is full. For children who have dyspraxia, we're going to notice that they're not using their tongue enough to be able to move the food. So an example of this is the kids that throw their head back to swallow. They're merely moving the food bolus from the front of the mouth to the back of the throat so they can swallow, because they lack the coordination or praxis, motor planning, to move the food with their tongue. So we work on a variety of games. Of course, it always comes back to play at Sprouts, where we might put little goldfish on the front of our teeth, and then we help them swim to the other side and swim back. We might play games where we're trying to get the tongue to extend out of the mouth. So we might play with lollipops and practice licking. So get your whole tongue out. And again, the sillier we are, the more fun we have, the more engaging it feels, the better the outcome and the results. I had a little guy that when he started, he did food therapy for an entire year. And it took supplements, it took support, it took trying different chairs before we finally got to the point that when he left, he will eat soup. This was a child who only ate what mom prepared at home, plain chicken, Cliff Bars, and fruit. That was pretty much our whole diet. And now we can do chicken nuggets, and we can do sandwiches, and we even put meat in our quesadillas, and we're able to handle wet, warm, sticky, all different types of textures and foods because it was slow exposure. It's not about forcing the child to comply. It's not about putting something in their mouth. It has to be their choice. You have to support them, therapeutically guide them, and entice them to engage with you so that it feels like it's their idea. I never put food in a child's mouth. I give them opportunities to explore with me. I model all of the play. We encourage the parents to model all of the play. Siblings even come in to model the play, because it's about showing the child that the food is safe, the food is not dangerous, that the food is fun, and it gives us energy to play. And that's what we need. We need energy to play. And when we put it in the context that the child can understand, not because I said so, not because it's good for you. Children think only adults eat good for you food. They're supposed to eat kid food. So I want to make all food accessible to kids. And that's really what we try to do at Sprouts.
Yeah. And I just want to say too that this, I think the SOS feeding therapy that you guys have, I mean, it's really exceptional. As far as I know, I think you guys are the only providers in the state with with this, with the feeding.
This much extensive training, and it's pretty much 80% or more of our staff are all SOS trained.
Right.
And it's multidisciplinary. It's our speech therapist and our occupational therapist, because it's a multidisciplinary approach. We need to look at the oral motor skills. We need to look at the safety of the swallow. We need to think about the medical concerns. We need to think about posture. Feeding is an incredibly complex task. And when children struggle with it, it's not because they don't want to be successful. It's because they need help and they don't know how to ask for it. And that's where we want to help you.
Right, yeah. And just to go back to that story with the child that had the really severe esophagitis and the super picky eating, so that child really improved a lot, and was able to, expand the foods that he was eating, and has been able to gain weight, and, so it's just things like that where you really see that, okay, it's
just
really helpful.
So motivating.
Yeah, right.
To see them successful, and the first time they eat that highly non-preferred food, or the first time mom says, yeah, we went to Subway and he ate a sandwich. I'm like, he did what?
Yeah. Right.
Because that's a big milestone for that family, to be able to go out to eat as a family and not take separate food for their child that's a picky eater. To be able to go to a family holiday and not have to hear from other family members, oh, well, why doesn't your child eat? Because so often people think it's just about choice. And oftentimes these children are either struggling with medical concerns that are non-visible, like the esophagitis or a hormonal imbalance, or they're truly struggling to sit at the table, or they're struggling to listen to your directions, or to tolerate even looking at the food that's at the table. So if we can slow down and see what part of the process is giving your child the most difficulty, then we can help you come up with the most individualized program to resolve those concerns.
Yeah. And so we're running out of time, so probably going to have to end soon. I know there's so much more that we can always talk about, but yeah, I mean, I just think about all the cases that I've seen. There's another child that I've seen recently, and he's coming here too, and it's just amazing to see the progress that this child has made. He was diagnosed on the autism spectrum, and had difficulty with social interaction, with food. He would have inappropriate behaviors. He would want to interact with the other kids, but it was like he just didn't really know how. And so he'd go up and then he just didn't know how to interact. He would just kind of stand there, and we found that he had an allergy actually to milk, and then he had problems with milk, and he also had a condition where it was an autoimmune condition where his immune system was actually attacking his own brain. And so there are specific treatments medically, that I can do for that. But that condition was actually blocking folate from getting into his brain. So we gave him a specific form of folate called folinic acid that can get into the brain, and that really helped with his language, his brain development, cognitive function. And then when we took milk out of his diet, then both his parents said, oh wow, we really noticed a difference. And then I found that when he came to Sprouts, he started improving in terms of his social interaction and having more appropriate behaviors. And now his parents are wanting to have him reevaluated, because more of the school teachers are saying he doesn't really look like he has autism. I mean, he's like appropriate with his behaviors, and he still struggles a little bit, but it's really minor. He doesn't look like he has autism anymore, which is so incredible, and I think that's really an example of how you know, with that kind of partnership, you know, we can help these children to be able to get better. And it's so rewarding. I know that's why we do what we do,
Yes,
you know,
100%.
'cause it's like, that's the whole motivation.
We just want to see them live happy, fulfilling, thriving lives. And that's why the motto that Crystal has here at Sprouts is Sprouting Minds and Bodies. Because it's not just one, it's everything tied together, and we just want to watch the kids blossom.
Yeah. So there's a comment over here. What's the name of the program and where is it located? So the clinic here is Sprouts Therapy, and they're in Kaimuki. And so you can find them on their website. It's sproutsTherapy.com, right?
And we're at 1210 Wilhelmina Rise, Suite B, right behind Goodwill.
Yeah. So so they're an incredible resource. I will say I refer a number of patients to you guys, and I just see incredible results, you know, when patients come to you guys. So yeah.
We thank you for that. We love getting to see your clients and welcoming more families to Sprouts. It's been a beautiful partnership.
Yeah. So yeah, so we're gonna have to finish up, but again, definitely check out Sprouts Therapy. They do have a Facebook page as well. And also, if you have interests in talking with me, I do provide a free 15-minute phone consult. So you can call us if you want to schedule a free 15-minute phone consult with me. Then you can call our new office number, 808-425-2987, and just let our staff know that you're interested in scheduling a free 15-minute phone consult. And that would be more, again, of the medical side in terms of special needs or other types of conditions. So again, want to thank you for joining, and please feel free to share the video with anyone that you feel would benefit from it. And we'll see you again in 2 weeks for our next Facebook Live session. Aloha.